Hey guys, good afternoon, everybody. You know, it's funny. I actually watched the video back and I can hear myself, but I can't hear you guys at all when you say good afternoon. So maybe say it louder. Good afternoon, everybody. There you go. I'm gonna go back and watch it and see if I hear that this week. Welcome to the Rotary Club of Brentwood. My name is Jennifer Bourne. I'm your fearless leader this year. Thank you. We have a great program for you today, and I hope everybody weathered the storm. Good. If you didn't, then you need help. I put that in reflections. Please reach out. That's what we're here for. Today, our invocation will be led by Steve Tate and our pledge and four-way test by Mike Huff.
Please bow your head as I pray. Dear Heavenly Father, Lord, we come to you today from different backgrounds, different lifestyles, Lord, different personalities. But Lord, we just pray that we'll come together today in this thing we call truth, Lord. I just pray that we, not only individually, but as a group, seek truth in our lives, Lord, because that's really what you are. And Lord, I just pray with all the uncertainty in the world, with all frankly, the chaos that's out there, Lord, it's only you that we can seek that truth and find that truth, Lord. I just pray each one of us will actually really do that, Lord. And I want to pray for the ones that are ill. I believe heard somebody actually in our group has passed. Can't recall their name, but I just want to pray for them and their family, and for Mr. Jeff Brown, who's apparently having some issues with his recent surgery. Lord, pray with him, comfort him, Lord, and give him some peace, and his family as well. And anybody else that might not know about, or anybody related to our group, Lord, just be with him as well. Pray for that. But Lord, again, I just want to thank you for these men and women in this room. I pray for each one of their families, Lord. We've had some rough times these last few days with the weather, and got people without electricity, Lord, and unfortunately some deaths around our state, Lord. I pray for them. And Lord, I know there's some more, maybe some weather coming this weekend, Lord, but again, just want to pray for safety for all of us, not just our group, Lord, but everybody involved. And the ones that still are suffering, Lord, just be with them, hopefully give them some relief. And again, just want to pray for that as well, Lord. And again, just want to always pray that we always seek your will. We thank you for your love, your mercy, and your grace, Lord. Again, we want to thank you for having us be together and precious food to our bodies that we're about to partake of. Amen.
I pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all. The four-way test: 1, 2, 3, 4.
All right, and next, our secretary, Jennifer Shepard, will introduce guests and visiting Rotarians.
Hey, everybody. Isn't it good to see other people's faces today? I'm so glad we could meet today, and I think a lot of us were ready for some fellowship and socialization. So we've got a couple of guests here today. Over here, Kimberly Calcote. Am I saying that correctly?
They may introduce you to Kimberly. Go ahead and stand up. Kimberly and I go to church together. Well, not just us two, but there's many other people there. Kimberly is a real estate agent with Benchmark, and she's also running for the school board, 7th district, 6th district, and she has a giving heart. So she would be very valuable for club. She is interested, so y'all be in your best behavior.
Don't scare her off is what you're saying? All right, then we've got two faces that you've seen before. They're in our membership pipeline. We've got Robert Evanoff and Becca Fox. Glad y'all are here. And that's it for today. Thanks.
Thank you. I did not tell Kimberly that we take blood as part of the initiation, but I think that'll be all right. I'm just kidding. Okay, we do have some announcements. I'm going to announce it again. Our Facebook page, if you are on social media, please like our new Facebook page. I think we have, we have a QR code. If you don't know how to find it, let me or Jared or Sana know, and we will make sure you get on there. We will communicate through that as well, especially last minute things. Laura, would you like to come up? One of the things, what is the phrase, ask and you shall receive? We asked for service opportunities and we received a lot.
Okay, so we have pushed the Harpeth River cleanup to next week. I'll let Patrick talk a little bit about that. But we also have an opportunity to serve at High Hopes on Sunday for their runway of hope for High Hopes. There is a sign up here or in Reflections if you have capacity to serve a shift anywhere there. Again, that's the organization that was started by Bob Searcy, or helped to be started by Bob Searcy. And it's a great opportunity for us to support them and the work that they're doing there. We also have the ongoing project with the carousel. And then we had a GraceWorks service opportunity in January. There's another one in February 21st, and that's going to be in Fairview at Fairview Middle School. So please sign up for that. We have pushed Rise Against Hunger. That was supposed to be the countywide Rotary service opportunity. It has been pushed to February 28th, and that's at Franklin High School. So please jump in and participate with that. Again, we will give you all the opportunities to serve that you would like. Additionally, we want to make sure that we mention the Super Butts opportunity with the Franklin Club. They do a Super Bowl smoked pork butt fundraiser. So it's a buy one, give one. If you don't need one, but you're willing to buy one, both can be given. I know some of our members have done that in the past. We did it last year as well. Am I missing any of them, Jennifer? Okay, then you let Patrick talk about it.
Patrick?
Thank you. As we made the call last week to kick a little Harpeth to next week, I think we made the right call given all that's going on in our community right now. We are hopeful that we'll get to do it next week. Right now, it is still on. I think there's still some questions that need to be answered, and we'll see what the weather does in the middle of next week. So, but that's the plan right now. I had a really good call yesterday with our friends at the Conservancy. The online sign-up process has gone well. They were already putting people into sections when we had our call, which is mind-blowing to me that the process is usually going on at 8:45 on Saturday mornings of the event. So that's going well. For those of you who have signed up to lead a section, and just let me remind you, in case you've forgotten, since it's been cold and dreary, Donald Weeks, Larry Kane, John Helm, Beth Dormany, Colleen Atwood, Bill Jetter, Drew Cressman, Ted Illichanian, God, I spelled it right, and Randy Lee. We will have a Zoom call on Monday. You'll be getting an email with the folks at Harpeth to kind of walk through that section leader process. It is not mandatory. It's just an opportunity for those of you that have never led a section to kind of talk through what we'll be asking you to do, most of which is just getting people to the right spot and keeping people from doing crazy things like getting in the river or trying to pull something out of the middle of the stream, that kind of thing. If it, again, is not mandatory, but if you can make that, it's 6 o'clock on Monday night. We've got about 80 people who've registered who will be coming to participate. That's outside of the leaders and different folks who will be helping. I also have a list of those of you who have agreed to help the morning of with sign-in registration and all that kind of good stuff. I'll be getting an email out to you as well. There's a half a dozen or so of you, which should be plenty to kind of help herd the cats and that kind of thing the morning of. So as of right now, we're good. We're on for next Saturday, same time, same place. And then if we need to pivot and do some different things during the week or next week, later next week, we'll make that call at that point in time. Anybody have any questions for me while I'm here? There are sign-up sheets. If you've already signed up, I've already got your information. If you would like to sign up today, please do so, and I'll check these sheets. Anyway, my work email and my mobile are always at your disposal if you need anything, but appreciate you very much. Thanks.
Thank you, Patrick. He pushed it up. Here we go. Okay, a couple other announcements. Rotary Grad School. If you have this burning desire to learn more about Rotary, there is this thing called Rotary Grad School. They happen twice a year. It's closed for this year. Norris and Bob Thompson have already signed up, so they're going to come with lots of knowledge. But if you ever have an interest in learning, I did it this past year. It's a lot. It's actually really informative, and I really appreciated it. So keep that in the back of your mind. Two more things. Sorry. GraceWorks. Laura mentioned that we are doing that on February 21st. There are monthly opportunities. So if you can't make one for some reason, don't stress out about that. We're going to have it again in March, or they're going to have it again, and we're going to try to participate. And I'm going to share those with you so you can at least make one of them or maybe two throughout the year. And the last thing I want to bring up before Linus comes up and shares with us is Pancake Day. Pancake Day, when I started this club, is an all hands on deck, right? Everybody goes, everybody participates, and everybody's a part of that process. It is going to be April 18th. So if you want to get out your phones and put it on your calendars, I can't remember if it's Brentwood Middle or Brentwood High School, but it's one of those high school. And it is going to be on April 18th this year. That date has been secured and confirmed with John and his team. So, all right, Linus, are you ready?
Thanks, Jennifer. So this is a BRCCF message. It is major grant season. Applications are being accepted for your major grant recipients. We will give away $10,000 to each of 3 to 5 local organizations as part of the major grant program. And so members are welcome to submit applications. The applications are available now. If you're ambitious, you can go on DACDB and download it. However, I will also email copies of the application to each of you after the meeting this afternoon. So you will have an application. This is what an application looks like. It isn't all that intimidating from an application perspective, but it does require the organization to put down some detail about how it is that they intend to use the $10,000 that they're asking us for. Couple of things, the applications are due by 1 o'clock Friday, March 6th. So there is limited time for you to submit that. Those chosen, those organizations that get major grants, they end up being front and center at Pancake Day and also front and center at the golf tournament. And we invite them and honor them as part of those deals. Something that's new this year, in prior years, we limited members to submitting just one application for a potential major grant recipient. This year, you may submit up to 2. So there you go. These organizations are not eligible to receive major grants this year because they have received major grants in one of the 3 prior years. That's one of our rules. You can only get major. What'd you do, Larry? You can only get a major grant once every 4 years. So that's the deal. These organizations are not eligible to receive, and we've already told a couple of them that that it's too soon for them to reply. They can get other kinds of grants from the BRCCF, but they can't get major grants. So get your applications in. Deadline March 6th, 1 o'clock. I'll probably make another announcement about it next week. Thanks.
All right, great. Thank you, Lennis. Okay, next up is Stephen Hammers, Happy Bucks. Stephen Hammers, Happy Bucks. I know, that's why I said your name.
Can you hear me? Who's happy? If you're happy, give me some money. Anybody happy? All right. Rod?
Like many of us, I'm happy because we finally got service back. And I'm thankful for NES, Middle Tennessee, and all the folks that are out there working in the cold and working hard to get us back up and running, and just thankful for the things that we do have, not that we don't have. Okay, so much appreciated.
I've been without power for 6 days, and my son will not help me.
Jason?
Yeah, like a lot of us had tree damage. The tree in my front yard, a maple, split and limb fell over my driveway, but another tree. So my son also was parked on the street. Limb fell directly next to his car. We moved it, and then 5 minutes later, the other part of the tree fell right where his was parked. So not happy with the quote to clean it all up, but still safe.
Wow. Anybody else over here?
Well, I'm just happy to be back. I was traveling. This is the first weekend this entire year that I'm actually going to be in Nashville the entire weekend. So blessed to see you guys. And I'm also excited that I moved into a downtown apartment in Nashville. I've been wanting to do this for about 2 or 3 years and just never did it. So I'm really excited to actually increase my social life, walkability. And then the second thing I'm happy for is that the Big Ten won the national championship for the 3 years in a row. And even though it wasn't my Buckeyes, it's better than the SEC's.
It's a red team. Anybody else over here? Everybody happy? Yep, I like your hat. Yeah, you want to give $1? Give me $1.
I'm happy that I now know that Michael Barrett has a hotel that we can all move into. Roger said that his family moved in with Michael. So if anybody doesn't have power, apparently Hotel Barrett is open for business.
You might rethink that. Roger also said the cooking is not so great there.
And Mike is not here today, but I would give a happy people. Thank you, Mike there.
All right. Cool. Anybody else?
Okay.
Dokey.
All right, great. Next, we're going to move on to our program and to introduce our speaker today, Asan Ershad.
Thank you, Jennifer. It's my honor to introduce Dr. Parker. He's a dear friend. He grew up in Baton Rouge, Louisiana, and is a LSU Tiger lifelong. I know football is quite sensitive. So he is a true family man who cares about others. He's married to a lovely lady, Dr. Erica Parker, and a proud father of 2 sons. Why he's here today, he's a medical professional. He acquired his medicine degree in Meharry Medical College and then completed his residence in Louisville. And he started his business called Iris Medical about 4 years ago, 2022. And it's expanding like no tomorrow. I think I will let him talk about what he does and what this organization, but primarily they're after hospital care. So I was thinking it's a target-rich environment, a lot of patients we get. But Dr. Parker is a local resident. He cares about the community. So I'm honored to invite him. So over to you, Dr. Parker.
Well, I don't have any slides. I appreciate you guys giving me some time today to come speak with the group. Tom, thanks for the invitation. I guess I'll start off. This will be pretty interactive, so interrupt me at any time. It's not formal. I want to answer any questions you guys may have. But I will start off telling you a little bit about myself, telling you a little bit about Iris, how Iris was founded, the mission behind Iris, and then I'll kind of field any questions that the group may have. That's okay. So I am, like Hassan said, I'm originally from Baton Rouge, Louisiana. There you go. And even though the Big Ten won it the last 3 years, LSU got a new coach, so be on the lookout. We're not short of talent there. We just needed a good coach, so hey, we got one now. So I'm excited about that. Truly a house divided. My wife is from Birmingham, Alabama, and cheers for another team. So truly a house divided. We got the grandparents that will have 2 boys. I have an 11-year-old who goes to Brentwood Academy, and I have a 9-year-old now that goes to Crockett Elementary. And so they grandparents are always sending collegiate gear, and it's a battle of what gear they wear on the weekend. So it's a good time. But I went to LSU, graduated from there, came up here to Meharry Medical College for medical school, 2004 to 2008. And then my wife went there as well. She's a physician too. 2 years behind me. She didn't date me in med school. We knew each other, but she told me I wasn't ready, whatever that means. So went up to Louisville for residency, did my residency in emergency medicine and internal medicine. Got dual board certified. I was chief resident at Louisville, and that's how I ended up dating my wife. As a chief resident, you can actually go and you're part of the interview process for incoming residents. And so I saw her name that she applied, reached out to her and said, hey, I know this interview trail can get expensive. So I offered up my place for her to stay as a alumni of Meharry, and she accepted, and yeah, the rest is history. So Louisville was good to us. She did her residency in emergency medicine. She didn't really want to live in Louisville, so I was 2 years ahead of her, went out to Louisville. She liked the shopping. I liked the professional sports, and we lived out in Indianapolis for 10 years, had 2 sons, Caden and Harrison. And the grandparents were having a little bit of difficulty getting back and forth, so we decided to move back to Nashville in December of 2019. And so we had a normal Christmas for the boys in Indianapolis, sold the house, fully furnished, moved out here. We wanted to be in this community, Williamson County, for the school system. And so the day after Christmas, we packed up and moved back down here. And then COVID hit, which was a great time, right? So I took a job with a contract management group when I first got back here, called American Physician Partners. I was a regional medical director for them. At the time, they had the contract for emergency medicine providers, hospitalists, as well as the ICU providers for all of CHS. So Clarksville, they had Shelbyville at the time, Tullahoma, Knoxville had two in Knoxville, one in Jefferson, one in Newport, and one in Chattanooga. So I was traveling a lot, and it was a lot on it. But part of the reason I mentioned that is because it afforded me the opportunity to be in leadership meetings with the executive C-suite level at the hospitals. And part of what they focused on was, how do we stop patients from, if they come to the emergency department and go home, how do we prevent them from coming back within 72 hours? If they're admitted in the hospital and go home, how do we prevent them from being readmitted in the hospital within 30 days? And if they are admitted in the hospital, how do we decrease their, what they call inpatient length of stay? Because what you don't realize is that the hospital is not the cleanest space. It's where all of the germs lie, right? Everybody's sick goes to the hospital. So the longer you stay in the hospital, the more chances you are to pick up what they call a hospital-acquired infection. And so they try to reduce the time you spend unnecessarily in the hospital. So they try to decrease that. And so they, some months the metrics would improve, and then some months they will go back down. And so it's just like this roller coaster, but nobody was focusing on or doing what we call a root cause analysis of the problem at hand. And the problem at hand is pretty simple. There was just not enough primary care doctors in the community. There's a national shortage of primary care doctors. It's published everywhere. Right now, they're estimating about 2034, 20 to 40,000 shortage of primary care doctors. And by 34, 4 years later, 2038, they're estimating anywhere from 75 to 80,000 shortage of it. And so it was already a shortage of primary doctors, lack of resources for the patients in the community. When providers write discharge orders, they have good intent. I'm a physician too, so they have good intent, and I was guilty of this too. But they write the discharge orders, and they automatically assume the patient has everything they need when they go home to follow those discharge instructions. Right? They have the resources for transportation to get to and from the clinic. They have a primary care doctor. They assume that they can get into their primary care doctor within 2-week time frame, right? And they assume they have the financial means to get back and forth to the pharmacy and actually afford the medicines, right? And none of that, all of that's just false assumptions. That everybody doesn't have that ability. And so Iris Medical Group, I just got, after COVID, it took a toll on the healthcare system in general, right? The public took a toll, but the healthcare, those working in the hospitals, including myself, just took a toll on us. COVID did interrupt us, right? But after COVID, the physician shortage got worse, right? They estimate about 115 to 120,000 doctors, primary care doctors, got out of medicine completely. That's national data. But then you have some doctors that stayed in primary care, but they went to a concierge model, and everybody can't afford that. So now you lose doctors that just retired. You have another subset of doctors that went to a concierge model, and now you have 2 out of 5 doctors right now are over the age of 65, and they'll retire in the next decade. And so it's just this huge gap in the community with primary care, and that's in metropolitan areas. We're not even talking about rural areas. And so, I just got fed up of it, got burned out of the hospital system, and took a leap of faith and started Iris Medical Group. So Iris Medical Group opened up its doors for business November 1st of 2022. The foundation of it was we wanted to help those patients from an acute or subacute facility. So whether it's a hospital, a rehab, a nursing home, a skilled nursing facility, when they get back into the community, how can Iris help, right? If they didn't have a primary care doctor, we would assume that role, but we wanted to make sure that they had the resources and that we can help out. And we wanted to eliminate any kind of barrier to healthcare risk out there. And our mission statement is simple. We just, it is simple as worship of God through service to mankind, right? And so when we interview providers to come onto our team, we stress that, right? We say, they ask us, will you take new grads? We look for providers that have a passion for patient care. That's number one. One that they work hard and they have some knowledge, right? I can teach you medicine. I can't teach you those other three, right? And so we stick to our mission, and that's kind of where Iris started, the foundation of it. And now it's expanded now, right? So I remember when we first started, I'll tell you a funny story. When we first started, we saw 4 patients in November, 10 patients in December. And I say that jokingly now, but at the time, I was nervous, right? I mean, I had my wife in there. My wife does aesthetics now. She's emergency medicine trained, but she got out of the ER. She does aesthetics. But she was in the office answering phones, right alongside me. I was answering phones too, calling hospitals, calling nursing homes, calling assisted living facilities, and just trying to get our word out about Iris Medical Group, right? And so now, looking back a little bit over 3.5 years old now, and now we have over 25,000 patients, and we're in 4 different states right now. And so we continually grow. We get about anywhere from about 1,200 to 1,300 new patient referrals every month. And my wife jokingly says, I can't believe this many people, they don't have primary care, but it's the truth. Our coverage area in Middle Tennessee goes from Memphis. Now Memphis, we just hired 2 providers in Memphis and 3 in Knoxville. But before, it went over to Jackson, over to Crossville, and then north and south to the Kentucky border and Alabama border. Now we're in Alabama, we're in Kentucky, we're in Indiana, and Illinois as well now. So we've essentially expanded our coverage, our service area. So now we not only offer primary care services, right, but we also offer transitional care. So if you get out of a hospital or a skilled nursing facility and you have a doctor, there's this transition period, a 30-day transition period that we take care of you, just in case you can't get into your doctor right away, right, which is common. So we offer palliative care services, psychiatric services, including ketamine therapy, which has been super beneficial for the opiate pandemic. We've gotten patients out for chronic opiate therapy, PTSD for some of our military folks, even all the way up to Clarksville area. They drive down for that. And we offer podiatry care as well as advanced wound care. And then next quarter, we will also offer cardiology and neurology in the home setting. And we also are in the process, we just got credentialed, or got the certificate of need from the state to also offer what we call Iris Now, which is an urgent care on wheels. So now if you have an urgent need, we can come out and dispatch right to your home as well. So we can do everything from blood work. We have a mobile lab with mobile phlebotomy. They will come to your home, draw your lab, collect your urine. We can do x-rays in the home as well. We can do ultrasounds in the home. We can do sleep studies in the home. We can do echocardiograms in the home. Obviously, we can do wound care as far as surgical debridement in the home, wound vac placements, and so forth in the home as well. So, it's been a fun ride. I thoroughly enjoyed it. It actually rekindled my passion for medicine. When you hear providers, particularly physicians, NPs, and PAs say they have provider burnout, it's a real phenomenon. Physician burnout is nobody writes a personal statement to med school or professional school saying they want to go into it for the money. Everybody's personal statement is some aspect of wanting to take care of patients because they care. And somewhere from getting accepted into med school and having years of clinical experience in the workforce, they lose that perspective. And I could tell some of my providers, that's okay. You just have to take a step back, reevaluate things, and see what got you to go into medicine in the first place. So Iris Medical Group has done that for me. I thoroughly enjoy it now and continue to enjoy this ride and continue to meet the need in the community. So that is Iris in a nutshell, but I'll stop now and see if I have any questions.
If I call you this afternoon,
Would you come to my home?
We see all new referrals within 72 hours.
What about hospitals? Do you provide primary care is part of it?
Primary care is not a part of hospice, but we do palliative care, which palliative care is like a bridge for those that aren't ready to actually go into hospice or accept hospice. Then we can still provide palliative care or chronic care management in the home setting. Yep.
Which states are you in?
So we are currently in Alabama, Tennessee, Kentucky, Indiana, and Illinois.
Any chance you're branching out to Louisiana? My parents and my family still live there, so
No.
it's hard there.
I have too many friends and family in Louisiana, and they abused me in med school.
Oh, no.
So- and I wasn't even a physician yet. So, but yeah, it maybe I'm credentialed there, but we'll see. No plans right now. Yeah. Oh, yeah.
First of all, congratulations. That's a great story. I
Okay.
mean, great idea, and you've obviously carried through. I'm just curious. So the doctors that come to work for you, are they employees of your company and they're paid accordingly, or do they get to bill on their own for what they do?
Good question. Good question. No. So, I failed to mention that too when I talked about concierge medicine. So our model is to eliminate any kind of barriers to healthcare risk or to healthcare access, right? And one of that barrier is financial. And so we don't charge a membership fee. We don't charge a subscription cost. We do everything through insurance. So we're in network with every major insurance carrier, including the VA and Medicare and Medicaid. We even take some self-pay as well. And so just if the only thing that we charge, and it's by law, we have to charge it, is if you go to like a brick and mortar clinic and you have a copay, then we have to bill you for a copay as well. But that's all that you would pay for us. But to answer your question, all of our providers are employed. So they're employed by Iris Medical Group. They are responsible for putting their own CPT codes or billing codes into the system. We do have another billing department and billing team and documentation review team that actually goes through that and make sure that they're billing appropriately. And then we also take a step further, and we every 6 months or so we contract with an outside auditor to audit out our claims. Yeah.
I enjoyed your speech. In terms of your business model for your practice, what is the role of physician extenders like nurse practitioners, PAs, things like that? Do you leverage your primary care doctors by using these types of providers to extend care? How do you incorporate those types?
Absolutely. Yeah. So absolutely. Great question. We actually do utilize the nurse practitioners and physician assistants pretty extensively. We do have 12 physicians on our team, and we have about 65 to 70 NPPAs on our team. We meet with our physician extenders every month. And then we also have quarterly, we have a quality review committee that reviews. By law, you have to review at least 20% of their charts. We review all of them. Yep.
Sir, so Hippocrates once said that let food be thy medicine and thy medicine be thy food. And I just saw that the HHS said that like they have to make mandatory, physicians and people in the medical field to learn nutrition. My question is, what do you think of that? And what do you think it took so long to mandatory people like in the medical field to learn about nutrition when I think it's pretty obvious that we have some of the worst food in the world, also the best marketing to back up said food. So let me talk about that.
I didn't hear that they made it mandatory. I think it's a great idea. But even outside of making it mandatory, it is taught pretty extensively, at least at my institution in residency, about nutrition. We work hand in hand with a dietitian on our team, particularly when you're dealing with wound care, because wound care in particular, people have chronic wounds for a reason, right? And one of the biggest things for wound care to properly heal is nutrition. And so we focus on that tremendously. Yep.
Hi, I have a client who's a physician and has a clinic up in Hendersonville, and they're pushing really hard to continue staying independent. And she actually just posted on LinkedIn this past week about, it's just really, really difficult to try and stay away from the allure of kind of partnering with private equity. So is there anything you kind of from your experience and kind of help physicians branch out the way that you did and kind of started your own model for them, try to stay independent with how difficult it is going up against like private equity and their ability to leverage?
It's tough. I mentioned earlier, all of our providers are employed, but when we first started out, all of our employees or all of our providers were 1099. And just because we could not afford an employee type of model, right? And so they were paid fee for service, and they were paid a percent of a certain rate for each patient that they saw. And then once after that lasted for about a year. And then after a year, we actually moved on to an employed model. But starting early on, particularly with the physician fee schedule cuts by CMS and Medicare cuts, as well as a lot of Medicare Advantage plans, it's hard to get in network with some of these carriers, insurance carriers. They have a time period that they allow you to enroll, and then they dictate the terms, right? You either agree to what they say that they will pay a physician, or you don't accept that insurance. And for our model, it was extremely difficult because we wanted to meet the demand in the community and never say no. And so we just accepted whatever they decided to pay us. With private equity, a lot of times you see a lot of groups will get acquired by some of these bigger corporations or bigger PE groups. We've been approached by some as well, but I think you lose that personal touch with medicine, right? So for us, our model is a little bit different. So if you go to a clinic, they are trying to crunch numbers, right? And trying to limit the amount of time a physician spends with a client, whether it's 10 to 12 minutes is on average. And if you have a patient that has 12 plus medications and has 4 or 5 comorbidities, it's difficult to cover all that in that 10 to 12 time frame. And so for our model, every new patient for us gets 1 hour with the provider. Every follow-up patient gets 45 minutes with that provider. And so it helps to establish a relationship with the patient. Once the patient establishes that relationship, it gains trust. Now they're 9 times out of 10 to be more compliant with your recommendations because they trust you. It also mitigates provider burnout because instead of going home to 35 to 40 chores to try to complete at home, the max number of patients our providers will see in a day is 9.
Dr. Parker, will you tell us a little more about Iris Now? And other than blood work, what does that do? And do you need to sign up for it ahead of time before you call a number?
Oh, no. So it'll be a number that you will call to be different from Iris Medical Group now. But our office will be right here in Brentwood. Our main office is right here on Overlook. It'll be in the same building. But it's just a dispatch service. So it's an urgent care. So we will have x-ray capabilities. We will have some antibiotic usage, antiemetics. So if you need Zofran, if you need IV fluids, we can do all that. If you need IV antibiotics, we can do that right there in the home setting. We can do suturing if you need that. What else can we, with that? We can do point of care blood testing and urine testing right there at the home. So just pretty much anything that you go into an urgent care facility, we'll be able to do right in the home setting. It'll be a dispatch service.
So when you began your talk, you mentioned right on the front end that there's a shortage of primary care physicians. Some are aging out. So I'd like to understand, are fewer people going into primary care?
Absolutely.
If that's the case. So where are you getting your primary care physicians to participate in Iris?
So there are a number of, so you have to think about, when you talk about a physician, physicians come out once a year, right? Because residencies, they start in July, they end in June. So new physicians will come out into the workforce in July. And so fewer residents or med students are going into primary care because one, the cost of medical education has skyrocketed and the number of loans that they're taking out has increased, as well as the number of grants they received has decreased. So their debt has gone up. With that being said, the reimbursement for primary care has decreased, and the subspecialty groups, whether it's surgery, cardiology, interventional radiology, those are more lucrative financially. And so those medical students are vying to go into those subspecialties. Mhm. That's correct.
But if you don't have that resource out there,
Mhm.
where do you get those?
So we utilize some nurse practitioners as well as physician assistants, but the physicians that we get are internal medicine or family medicine trained. They are looking for change in their current workforce. So some of them were hospitalists in the hospital setting. Some are primary care clinics that they were working for bigger hospital groups or contract ministry groups or some PE groups. And so they want to get out of that model of seeing 10 to 12 patients or spending 10 to 12 minutes with each patient and come over to our model.
From a resource that's already there, you're taking from primary care physicians who are already practicing as primary care physicians that maybe are disgruntled with maybe the environment that they're in, coming to your place, but still there's a problem coming out of med school, if you will, going into primary care, right?
100%. That's correct. And even some of the primary care doctors are operating in a primary care capacity. They are vying to go and work in a hospital as a hospitalist. And the hospitalists are, instead of the primary care doctors of old, where they would see patients in the clinic and then go see their patients in the hospital, now they rely on the hospitalist service to take care of their patients in the hospital. And they're going into that model too. Yep.
Kind of like the same question, I think. If you take on a patient at home and then they have to be referred into the hospital, do you follow them into the hospital?
We do not. No, sir. We rely on the hospitalist service to manage those patients as well.
And then also from a reimbursement standpoint, since insurance and Medicare is so low, how are you making it work with these doctors and get a patient today and you're seeing 9?
It's tough. It is tough. We make it work, but we had to expand our services. And so one of the reasons we expanded our services to include the transitional, the palliative, the primary, the wound care, the podiatry care, is that they reimburse more than a typical primary care visit, right? But also from our standpoint, primary care visits you can bill on, CMS allows you to bill on complexity or on time. And so if you're in a clinic and you're billing for a 10 to 12 minute visit, or for us, we can bill for a 45-minute visit. It's not, you would think that it's a big increase, but it's really not. And so we have to rely on volume at that standpoint. And so the more providers we have, it used to be if we were strictly in primary, the more providers we had, the easier it was to bring on new providers from a reimbursement standpoint and revenue standpoint. And so now, with our expansion of our services, we're able to have a good workflow, good model.
Hey.
Hey.
I'm really interested in this a lot because of being
You've been so
self-employed.
quiet, though.
Self-employed, insurance is a mess. One of my biggest gripes about our healthcare system is the lack of transparency in pricing. And so you go to the doctor and then you don't realize, oh, I went to this facility that's approved, but this one doctor who I didn't even see also billed me, or that person was out of network. Someone who opened the door and spoke to me was out of network. I get billed for that too. And so you're getting bill. Are you able to upfront price, or are you still at the mercy of the insurance companies?
Well, we're yes and no. So we are at the mercy of insurance, but we agreed when we signed the insurance contract, we agreed for those rates that they agreed to reimburse us with. If you were to call our office, one of the first things our intake team does is collect your insurance information. And while you're on the phone, they run what we call an IVR, insurance verification request. And with that, it will let you know exactly what your out-of-pocket costs will be. And so we're pretty transparent from that standpoint, just because we don't do any surprise billing. What the insurance pays is what we collect. What they don't pay, we don't send a bill to the patient to collect the balance. Yeah.
So on leading on what she said, Laura was saying, if you were coaching and designing a system that is more transparent with pricing. Because I own a business and I literally buy insurance just to make sure like prescription drugs are $10, you know, and you're like, oh my gosh, this costs way more than I thought it was going to cost versus I just sign up with you, you know, like how would you redesign the system and coach people like us to make those decisions?
That's a loaded question, man. I mean, in my opinion, I mean, the healthcare system is broken. I mean, as I said, it's broken. And so we're trying to do, Iris Medical Group is trying to do its part to try to meet the demand in a broken system, right? We're not perfect. I don't claim to claim that Iris is perfect, but I think our model, it goes against the norm. And because of that, I think that's one of the reasons why we've been successful so far.
Are your reimbursement rates same as primary care physician who has bricks and mortar building?
Absolutely. So essentially you can view us as a brick and mortar clinic that's just moving around town.
Right. Okay.
Yep.
Different overhead, but
yep,
same reimbursement.
Absolutely.
Okay.
Thank you.
Sure. Okay, so thank you very much. It's so nice to meet you. We give a gift. So as a thank you for coming, we read to elementary school kids a couple times a year. And so if you'll sign our book, tell us a little bit about yourself in the book.
Yeah.
We'd like to share with them about your time with us today.
I love it.
Yeah, that's great. And we go to Crockett too. So there you go.
Good deal. Thank you.
Yes, thank you. All right. A couple of announcements before we part. I want to re-welcome our guests, Kimberly and Becca stepped out for a second, and Robert. It's good to see you all again. So thank you for coming. Dr. Parker, thank you again for coming. Next week, we have, if you were here last week, you recall, we have Mike Huff, one of our newest members, who's lived in Brentwood since I said the 40s, but I don't think that was correct. He is going to be coming to talk to us about Brentwood history pre-1969. Charles Booth, our communications director for the city, is going to be doing kind of like what Drew and Lindsay did 2 weeks ago up here, a question and answer. And Mike's going to share some stories with us. And it's going to be really, I've seen it before years ago, and it's really interesting. So if you are available, or if you weren't thinking about coming, come anyway, and invite somebody. If somebody lives here, is new to the community, this is a great opportunity to get them into Rotary. And then they're going to learn something about the city of Brentwood as well. If you do not see somebody in this room that you have thought about, reach out to them. If you we still have members without power. We have members sitting in hotels in Franklin, downtown Nashville. We have members who are impacted. So if you do not see somebody, if you'll do me one favor this week, just reach out to one person and check in on them. Hopefully we're not all reaching out to the same person, but do that. And that way we can be there to help them. If they need anything and we don't know about it, please let myself, Susie, Sana, Michael Barrett, a family of Rotary, know, so we can jump up and be there for them as part of that. Claudia. Yeah, the second we hear about that, if it is outside of a reflections schedule, I will send the obituary information out and the visitation stuff. So that way everybody knows about that.
Services, visitation
on Friday,
February 7th.
Okay. Okay. All right. If you hear any more about that, will you? Okay, perfect. Okay. All right. Thank you guys for coming. Very last thing, I promise. Stacks of 8, not against the wall, chairs and tables to pick up. If there's nothing else. All right. For the good of Rotary. Wow.